Major muscle. This is the anterior fold of the axilla.
Oh, sorry. Oh, sorry.
And you can clearly see the deltoid muscle here. And you're seeing the axilla. Now I want you to identify
I really can't see that.
what is this? Here also you see some branch here. I was telling in the class, this nerve, second intercostal nerve, intercostal brachial nerve, which has to supply the floor of the axilla, right? And yes. I'm holding a nerve here which is running closely to the medial wall of the axilla, right? Which is joined by C5, C6, C7. This is the long thoracic nerve. Long thoracic nerve. Right? So this is the long thoracic nerve. In this specimen, we are seeing the pectoralis major muscle, and you can see the pectoralis minor also deep. See the pectoralis minor muscle. This is the pectoralis minor, right? Which are present. Both these muscles we studied in the class today, right? And I'll try to show some of the structures in this specimen. So in this specimen, what I want you to know is, here is the pectoralis major muscle, right? And deep to that is the pectoralis minor muscle, which are forming the anterior wall of the axilla. Now again we are seeing the flexor compartment of the arm. Now this is the biceps muscle, right? You can see the long head of biceps here and short head of biceps. Always when you see the specimen, the short head of biceps is thicker than the long head of biceps, right? Then along with the short head of biceps, you see the coracobrachialis muscle is present. This is the coracobrachialis muscle, and this is the nerve coming out of the coracobrachialis, musculocutaneous nerve. As you come down, you see this muscle here, that is the brachialis muscle, right? And in this specimen, you can clearly see the axillary artery here, continuing down as a brachial artery, right? And if I trace this musculocutaneous nerve, I wanted you to see the lateral cord of the brachial plexus here. This is the lateral cord of the brachial plexus. We have studied the lateral cord of the brachial plexus gives three branches: musculocutaneous nerve, lateral pectoral nerve, and lateral root of the median nerve. Right? Now I am tracing this musculocutaneous nerve back to the lateral cord of the brachial plexus, and I am able to get the lateral root of the median nerve. See this one? This is the lateral root of the median nerve, right? And this is the medial root of the median nerve. Both are joining together to form the median nerve. So this is the median nerve. Okay? This is the median nerve which you are identifying here, formed by lateral and medial cord of the brachial plexus. Lateral root of the median nerve and medial root of the median nerve is joined to form the median nerve. This nerve is supplying the muscles in the forearm and few muscles in the hand. Now, as you trace this nerve, see here, this nerve, I am tracing it here now, near the See, this nerve is present here. The same median nerve, right? Running in front of the wrist joint, right? Now, I forgot to mention about this one in the class. We have studied what are the clinical conditions. If some nerve, radial nerve is damaged, it results in wrist loss. Ulnar nerve is damaged, we know it causes claw hand, right? So this nerve, the median nerve is running in the wrist joint. This is what we call flexor retinaculum, this one, what I am holding. So any damage to the median nerve under this flexor retinaculum, any compression of the median nerve under the flexor compartment, flexor retinaculum, then it is called carpal tunnel syndrome.
So compression of the compartment.
Yes. Compression of the median nerve in the carpal tunnel under the flexor retinaculum. Right? So that is the median nerve. Now, if I see this, what I want you to know is, I showed the musculocutaneous nerve, right? And I was able to identify the lateral part of the brachial plexus. Then I got the median nerve, and through the medial root of the median nerve, which is this one, the medial root of the median nerve, right? I am going to see, this is what the medial part of the brachial plexus. See, what I am holding is the medial part of the brachial plexus. We have seen the lateral part of the brachial plexus here. This is the medial part of the brachial plexus, and here is the posterior part of the brachial plexus. So, lateral cord, medial cord, and posterior part of the brachial plexus. Right? All the three cords you can identify. This is the axillary artery. So you are seeing all the structures in the axilla now. Axillary artery. Right? Now see, one of the branch of the axillary artery, I told there is a subscapular artery. This is the subscapularis muscle. So going to the subscapularis muscle, that is the third part of the axillary artery, right? So one of the branch you are seeing here, and circumflex scapular artery you are seeing here. Subscapular artery and circumflex scapular artery. So you are able to identify three cords of the brachial plexus. Now this is the nerve. When you touch here the bony prominence, you can feel by yourself just on the medial side of the elbow. You are touching this part. See? You are touching this bone. This is the humerus, lower end of the humerus. You are touching this bony projection, this one what I am pointing. This is called medial epicondyle. Okay? Now feel the medial epicondyle by yourself. You can touch and feel the medial epicondyle and roll the finger below the medial epicondyle. Are you able to feel some sensation? See here. This is the medial epicondyle I am pointing out here, right? This is the medial epicondyle. And I am rolling the finger right deep to the medial epicondyle. Huh? Any changes? Anything? Can you feel that this shocking sensation? You are rolling the ulnar nerve deep to the medial epicondyle. So this is the ulnar nerve deep to the medial epicondyle of the humerus. This is the ulnar nerve. Ulnar nerve comes from medial cord of the brachial plexus. If I trace it back, this is the medial cord of the brachial plexus. Right? So this is the ulnar nerve. So what I want to tell is, this is the approach how you are going to identify the different nerves, to identify different branches of the brachial plexus, like going to one card and tracing all the branches coming from that card. Right? So behind the medial epicondyle you see the ulnar nerve, but medial card can also be identified with the medial root of the median nerve. Right? questions, anything you want to clarify? What is this one? Ulnar nerve. Again you are seeing the medial epicondylia. This is the ulnar nerve. And here you see, what is this one? That is the median nerve. So what I suggest is just try to identify these three muscles, right? In the next class you are going to see other muscles also and see the muscles forming the spaces of the intermuscular spaces and try to identify first and the foremost thing, try to differentiate artery, vein and nerve. Most of you are unable to identify which is artery, which is vein. Now, I want you to, if you don't mind, just nothing is going to happen. Feel the artery and vein. See the artery, always the lumen is patent. Okay? If you see the vein, the lumen will be collapsed. See, this is one of the vein. Don't try to identify the vein based on the color. When you go to the operation theatre, artery vein looks same. There is no difference in the color. So see this, feel the difference. There is a brachial artery, right? There is also a vein accompanying here. Feel the difference. Lumen of the vein will be collapsed and the walls of the vein are very thin. The artery walls are very thick, lumen is patent. And the nerves, there is no lumen, it is like a cord-like structure. So see the difference and try to identify the brachial artery, axillary artery and different parts of the brachial artery.